Ankle sprain physical therapy rehab. Plenty of research has shown that physical therapy aids recovery from meniscus tears and other joint injuries. But for a sprained ankle, save your money and rehab at home, suggests a new study published in the British Medical Journal. Physical therapy is often recommended for lateral ankle sprains, the most common musculoskeletal injury among physically active folks. To find out if PT is really necessary, researchers from Queen's University in Canada rounded up 503 patients who'd torn a lateral or outer ankle ligament and monitored their recovery. Over the next 6 months, everyone was instructed to rest, ice, elevate, apply compression, and restrict weight-bearing activities on their own. On top of that, half of the patients were assigned up to 7 sessions of physical therapy. At 1, 3, and 6 months, the researchers assessed both groups' recovery. At no time were the participants receiving PT faring any better than the participants who did self-care. Everyone's ankle functionality, on average, progressed about equally. Intuitively, you'd expect that if you were getting additional therapy, you'd see better results, says lead researcher Brenda Brower. But we just didn't see that in terms of functional benefits. It's not clear why the groups made similar progress. Brower says it's possible that physical therapists aren't employing the most effective tactics or modalities. Or maybe the fault lies with the patients, perhaps people in physical therapy slack on self-care. Or, now that there's so much readily available information on how to handle a sprain, she says maybe people are doing a better job of self-care and don't necessarily need physical therapy. This doesn't mean PT is totally worthless for ankle sprains. It's virtually harmless, and depending on the particulars of the injury, it could help you recover better than self-care. To some extent, physical therapy is very much a personal choice, Brower says. Some people like to be monitored regularly to make sure everything is okay, that they're doing what they're supposed to, that they're recovering as the therapist might expect. It's nice peace of mind, and I don't mean that to belittle its potential physical benefits. No matter which mode of recovery you choose, anytime you hurt your ankle, Brower strongly advises having a doctor or physical therapist diagnose the issue. According to a companion paper on Brower's study, more than half of all people with lateral ankle sprains fail to get their joint checked out. That, and because they don't fully commit to rehab, is a big reason why more than 40% don't recover completely. They battle nagging pain and instability, sometimes for years, and often wind up re-injuring that ligament. Don't let this be you. See your doctor first, get a diagnosis, discuss your treatment options, and then decide whether or not to do PT. Benefits of Mulligan concept in physical therapy. The Mulligan concept was developed by a physical therapist from New Zealand named Brian Mulligan. The practice involves manual therapy techniques designed to relieve pain and increase range of motion, and is often used to treat conditions including neck and back pain, shoulder pain, impingement, ankle sprains, tennis elbow, and cerviogenic headaches and dizziness, also known as mobilization with movement. The Mulligan concept uses the benefit of passive mobilization and adds active movement to produce the desired range of motion and degree of pain relief. Not every physical therapy clinic will have a therapist trained in this manual therapy technique, so you may need to search around until you find someone certified to teach the concept. The Mulligan concept involves weight-bearing techniques, using patient feedback and functional movement to diagnose and correct positional faults and restore patients to normal pain-free function. By helping the body and its joints function in a more normal biomechanically efficient manner, Therapists that practice the Mulligan concept can help patients with shoulder pain, tennis elbow and back stiffness. The goal behind Mulligan techniques is both an increase in range of motion and the relief of pain, using kneading and manipulation of muscle techniques. Joint mobilization and joint manipulation. A Mulligan practitioner can help patients return to normal pain-free function faster. Proponents of Mulligan techniques claim that signs and symptoms are improved and that the use of manual therapy highlights the value of movement in maintaining health and strength of collagenous, muscular and bony tissue. The improvement of signs is associated with pain being the principal signal of malaligned joints. Pain is a sign that treatment is not working and a clear indication that the technique should be changed. With the Mulligan concept, the relief of pain from a mechanical amendment is the signal that the objective has been achieved. These clear signals allow therapists to provide more efficient and targeted care for back pain, ankle sprains and reduced movement in the shoulders. Physical therapy can't guarantee results, but some techniques provide a better chance of healing when it comes to specific injuries and debilitating conditions. Mulligan methods have been cited for improving conditions including back pain, shoulder pain, ankle sprains and tennis elbow, and should be considered as an option for relieving pain and returning normal range of motion. If you are interested in pursuing this course of therapy, find a therapist certified to perform mobilizations with movement.